Hello and good day. Today my group will share about medication adherence. So what is medication adherence? Medication adherence is a term referring to the act of the patient taking their medications or drugs that been prescribed by their physician. So how does this issue happen? There are two barriers that can describe why some patients could not adhere to their medications. The first one will be the physician. Physician is the one that prescribes the medication to the patient, and during the counseling sessions, the physician may use some complex medical terms or jargon terms which can cause confusion to the patients, which can cause the patient could not understand what being discussed or by the physician when they are prescribing their medications, and this can result in the patient did not know how to take their medication as well as why they need to take their medications, and this can contribute to non-adherence to the drugs. The second one will be on the polypharmacy, which a term that refers to multiple drugs being prescribed to a patient, although their condition is not too severe. And too many drugs that be prescribed to a patient can make them worry because their condition is not too sick to get that much of medications, and this can lead to non-adherence of the drugs or their medications. So the second one will be from the patient. So patients sometimes too busy with their works. They have their packed schedule, they have their own commitments, which sometimes they forget to take their medications. And this forgetfulness can contribute to the non-adherence towards their medications. And the last factor would be the negative belief towards medications. So there's some study that state that public perceptions toward medications can affect the adherence to the medication, and through their research, that means state that negative belief toward medication can cause the patient to not adhere to their medications. And for conclusion, there are two types of barriers that can prevent drug adherence in the patient, and the first one will be on the physician, and the second one will be the patient itself. With that, thank you.
Assalamualaikum and hi everyone. Today I want to talk about how pharmacists can help patients to increase their adherence towards the medication. So the first one is the pharmacist need to explain all the key information when prescribing the medication. So the example of the key information is what is the drug, when to take the medication, and how long to take the medication. Next, the pharmacy also need to tell about the common side effect that the patient will have when taking the medication. This is important because this can help the patient to become more aware and well known about the medication that the patient take during their treatment. So the next point is using the medication aid. So medication aid is the tools that will help patient to take the medication easily. So the example of the medication aid is medication calendar, medication charts, and the best one is the pill box. So the pill box usually will come with the reminder that help the patient to take the medication on the time. So with all these aids, so this can help the patient to increase their adherence because they can take the medication easily without any problems. The last point is recommend the patient to stick with only one pharmacy. This is also important because, as we know, all the pharmacists in the world have their different opinions about the medication. Maybe one pharmacist say this and another pharmacist say this. So this can make the patient become confused about the medication and make the patient not to take the medication. The pharmacist can easily help and monitor about the patient condition when taking the medication. I hope all the knowledge that I share today can help the patient out there to improve their medication adherence towards the medication. That's all from me. Thank you.
Assalamualaikum and hi everyone. My name is Akmal Ismail, and today I would like to share to you 3 tips and strategy that you can do to increase your medication adherence. So, the first tips is practice to take your medication at the same time every day. So by doing this, eventually it will be developed into your habit or your daily routine. For example, if you take your medication at the same time, 8 a.m. in the morning, it will become like your daily practice, like taking your breakfast or eating your lunch. So by doing that, it will hard for you to forget to take your medication then. So the next, we'll move to the next one, which is the second tips is create a medication calendar and note each time a dose is taken. So this is also a great way for you to track record your medication consumption. You can notice if you miss a dose and quickly take the medication as prescribed. It is also can act as a proof or evidence that you can show to your doctor or physician that you are taking your medication as prescribed. And last but not least, the third tips, which is if you are using a pill container, I advise to you to refill it at the same time for each week. So the same goes to the same as the first strategies. This activity will help you to remember and to refill your medication. And for example, if you go to a vacation or holiday and you want to take medication, and there it is, your medication pill box is ready for you, full with your medication, and you will not forget anymore. So I think that is all from me, and I hope these tips and strategy can help you guys to increase to your medication adherence.
No one in this world never had a family or friends. Even how lonely you are, at least you must have one in your life. Thus, in context of medication adherence, how family and friends can create awareness about the drug adherence. Firstly, with the presence of family and friends absolutely will help to boost patient motivation. So how will this work? It works when family or friends keep giving hopes or and a positive vibe to light up the patient's spirit, especially for terminally ill patients such as AIDS patient and also cancer patient. Second, family and friends also can increase patient awareness towards medication adherence by helping the patient to understand well regarding the medication instruction, especially when it comes to elderly patient. Sometimes this type of patient keep mess up between which type and also the function of medication. By the end of the day, the disease that have been faced by the elderly patient does not improve due to the wrong intake of the medication. Thus, with a hand or help by family members or friends will help patient to adhere accordingly to medication as prescribed by the doctors. Finally, when it comes to elderly patient, those forgot words or forgets words is such a normal due to their older age. However, adults, even teenagers nowadays had the same issues when it comes to the medication issues. Hence, with the presence of family members and also friends will help to increase their awareness to do towards the medication. As the family members and also friends is the most closest one, especially when it's related to the patient. Thus, a reminder by a family members and friends will help patients to increase their awareness towards the drugs adherence. As a conclusion, everyone needs to play their own role perfectly in order to create awareness about the drug adherence, not just effort by the professional healthcare such as physicians, pharmacists, nurses, and so on. Patient also can help to create awareness about the drug adherence, not just for the patient itself, but they also can help other people around them by showing a good example of importance to keep adhere to the medication given. Last but not least, don't forget about the family members and friends. They also play a huge role in order to create better surrounding of awareness about the drug adherence because they are the closest person to the patient if we are gonna compare to anyone else in this world. That's all from us. Thank you.